Hi, my name is Diego. I've been working as a web developer for almost 20 years. I'm 33 and I'm from Brazil, from a very small city called Ipatinga in the Minas Gerais state at the east side. Actually, not so small because we are almost 400,000 people. And nowadays, I've been living in Caratinga to take my medicine classes, and so now I'm trying to be a doctor as well. As you can see, Brazil is here, and if we type Caratinga, it's an indigenous word. I actually don't remember what it means. You will see this small city. Caratinga is around, I believe, around 100,000 people, and it's not a very well done city because you can see we have a lot of hills, and it's a very old city. Caratinga has, I think, more than 150 years. So I got some money. I got some money lent from the government to study here, and I actually would like to study kind of for free in a medicine college, a federal college, but for some reasons we will talk in the other episodes. I think I didn't get yet in the free medicine college. I do that because we will talk about some stuff about what is free or not in Brazil. And I know many Americans and a lot of people around the world would like to have a free health, free educational system, but it's not actually free. There are some costs, and we'll talk about it. I hope I will be very impartial about that. I don't know if that's the right word, but I try to not say, oh, some politician is right and some other is wrong. I will try to talk about what could be better. I think that's the best way to talk about it. So that's my platform. You can come here and you build your own website and a lot of another online platforms. I work with Google Ads and SEO as well, and I try to balance all this stuff with my college. And I would like to speak to about some software I saw today. Versa Technology, they are providing the software to the kind of public hospital. I went today. Today was my very first day in the hospital. Here in the medicine college, we start going to the public hospital in the very first week, which I thought very cool because I kind of didn't like the other class very much. Because of that, I've been studying through YouTube. It's way better. You can see some stuff about cells. In Portuguese, we call it histologia. Probably in English is histology. And I've been watching some very cool stuff about anatomy as well with Natalia Rinaik and Rogério Gozzi. These are my best teachers right now on YouTube. I also purchased a login in another platform called something Flix. I forgot the name. Sanarflix. And I think this software is very cool, and all the doctors in Caratinga are liking it, but they would like to have a integrated database so they could have the same information for a patient here in Caratinga or in Rio de Janeiro or in São Paulo state, and that's not possible yet. A lot of stuff in Brazil are already integrated. We have a central website called gov.br, which is very cool. We have something called working card. It's like in the old times it was in paper, but nowadays it's an app, which is very cool and save us a lot of time with the bureaucracy. I've been very happy about it. and the same login you can check your information about your working information, working data. You can check about inem is like a global test to get into the free college in Brazil. So I've been studying to get into the free college for 6 years during my free schedule. So it's not actually free and easy to get in, especially for medicine college. I believe living in a third world to get the medicine college is like a dream. It's very very different life from everything else. I believe even in the US and in the other countries I know about it as well. I've actually lived in the US for a while, in California, Silicon Valley. I went there because my software skills, but actually I'm not a very good programmer. I've been working with I'm actually more a project guy, and I put some stuff together about open source software. I do some a little bit of code, but a lot of research, and I have a partner who is a genius for me. I believe God put him on my way. And when I met him in the first company we worked together, it was we use it to fight a lot, and it was nowadays we remember that and we think that is very funny. So he's the guy who is dealing with a lot of very hard stuff in our platform nowadays. So I've been wondering about government platform and what we could do to help them. Actually, nowadays we can't do a lot because our company is not still a rich company. We have just 100 clients, which is giving me around $5,000, 5,000 reals per month, which is around just $1,000, even less nowadays. Some years ago, our currency was like 1 to 2, comparing to dollar, right? Nowadays is almost 6, and a lot of stuff happened at this time. We took out a president, another one came in, and he was a thief as well. But he did some stuff. For example, previously our inflation was around 14%, and the that stuff in the US you guys call it Fed something, Fed interest, right? In Brazil, like Fed interest was around 14% as well. So instead to invest in the companies, people were just lending money to the government, and jobs were not being created. So these new thief president politicians, like always, who got into the power, he load down the Fed. I do that because here we don't call it Fed. We call it, for now we can call it Fed, right? We call it something else. But he load down it to around 3%, and nowadays I think it's even less. But the inflation raised a lot as well. So it seems the new president, who is like a Trump guy, as the rest of the world say, and a lot of people here say that as well. He's doing some stuff different. With some stuff are good, some stuff are not. But he's not a polite or a smart guy. He's not someone who is a saint or doesn't steal anything. But for sure he doesn't steal the last party before the last thief, Lula, from PT, and Dilma. They were stealing a lot, but the new one, he's not a saint as well. What else can I say? So I've been trying to come up with something to the government. So, for example, his WordPress. WordPress is an open source software from which you can have a core software to build a simple blog, but you can also search for a plugin what is a function, and you can install it in the core software to improve it. And a lot of cities like Caratinga, they hire their own software like Versatech. So nowadays we have a lot of cities hiring a lot of softwares, and for example some softwares to print the the note proving you paid some tax. Here we call it a nota fiscal. I don't know how it's called in the UX, like maybe tax paper proof. A lot of cities hire developers to build that, and they are always building a new one to pay bribes. You know, the hired guy will pay bribes to them, and because of them they are always starting a new one. So I believe the Brazilian government were supposed to have a core software and hire people to build plugins, and some stuff was supposed, I think, was supposed to be federal, and some others no, and some stuff could be like an optional stuff, like, oh, this one I will use the federal one, and this one I want. So this way you want to have these bribes happening, and we're supposed to be able to vote to some stuff through the web already. I I think there is a name for that, like open democracy, something like that. But I don't think we are close enough for that. But maybe if some guy do something like that, what problem is already happening, we could implement that in a city, and then in a state, and then maybe in a country one day, and present that in the UN. Who knows? So my very first day in Caratinga, in the hospital, I saw that software and I wondered about that stuff again. I've been wondering about that. I will try to show you guys some stuff, but here is not very good to see because there are a lot of hills. It's not an easy city to live in. In the very first day, we saw a woman there who was probably with COVID. We were using all the equipment to protect us against COVID. And let me put okay, here we go. Maybe this. Oh, here we go. See, it's not a beautiful thing to see. But here is even okay, I see where we are. Yeah, undeveloped country, there are many cities who aren't beautiful. When I first arrived in the US, I thought, oh man, it wasn't a human being who built that, because it was very, very beautiful. Here we have a lot of houses that are not painted. We have something called director plan, which was supposed to be followed, but actually there is no fiscalization. I don't know if fiscalization is a word that exists, but the mayor team was supposed to check it out and see, oh, you are not doing this building well, we didn't agree with that, like it happens in the US, but here it doesn't work. In some new cities and in some cities below São Paulo, things are already a lot different. But above from São Paulo, things aren't so beautiful, especially in the northeast. So the free hospital, we have some very basic stuff happening there. but you can also get free treatment for HIV disease and cancer. But for free treatment for cancer, for example, it's not actually working as it was supposed, because cancer you are supposed to treat it very fast, and I don't believe that happens in the free program, which is called SUS, SUS, System Healthy Unified System, something like that in Portuguese. We saw the teacher was awesome. I didn't like the other teachers. I'm the first period of the college. I think I wasn't supposed to say I didn't like the other ones. I didn't like them so much. This one I liked him a lot. He's a very passionate guy. He's very young. He's just 26, and he talks about stuff very passionate. He's very attention, and he treated everybody very well and explained us all the steps he took during the procedures. We saw two women who were pregnant, and we were in a very poor neighborhood in the very top of the hill. He told us a lot of people there have a lot of children. Nowadays, people already talk about do some procedures to not have children anymore, which also covered by the government. But all this stuff has a cost. For example, we are just one country, a huge country with a lot of states, and we have a tax called ICMS. So if someone wants to kind of import some product from a state to another one, we are supposed to pay a huge tax. I believe my state is the highest one, 30%. So these taxes to cover all this stuff, they actually prohibit people to have a good job, to have a good wage, good incoming, and is preventing jobs from being created. And if you want to hire someone, you will probably pay almost the double in taxes in the whole country. It's not like I know California has a very high tax. Here is not just in one state, it's in the whole country. It works like that for the hired people. If you have if you make more than $400 per month, you're already supposed to pay like not just 400, like 800, for example, or 1,100. You're already supposed to pay around 30% over your incoming. So basically everything we buy here, we pay around 60%, 70% in taxes. And people say, oh, that's left-wing stuff or right-wing stuff, extreme wing stuff, just like in the US. But actually, people, most part of the time, they aren't even able to understand a graph, a simple graph, or do some very basic math stuff, system, and understand the numbers. And a lot of times things we think was done for right wings who were supposed to be classical liberal, which I think in the US you guys call it libertarian nowadays, because liberal is some synonym for left wings. In Brazil you say liberal like in an economy, like in the classical meaning. For example, the dictatorship, which lasted until 1989, if I'm not mistaken. In 1985, it was already crashing down because inflation was very high in the end, They say it was because the oil and all this stuff, but no, they were incompetent. In the end, that got very clear. They were landing, uh, getting land. Yeah, they were getting a very high loan from the U.S. too, and we couldn't pay stuff anymore. And people here think the dictatorship was from the right wings because it was in some ways implemented to prevent communists to took the power, but I don't know, it seems more like a fight between some powerful people and that's it, because they are the ones who implanted the current tax system, which is over the consumption. When you buy some stuff, you pay a lot of tax. That doesn't happen in the US. In the US, you pay around 6-7% in taxes when you buy something. Here we pay like 6-70%, and there are all the other taxes, and that was implemented by the dictatorship, what they call right wing stuff, but that's not liberal stuff. So I think the best way to talk about politicians is like, oh, that's a liberal attitude, or that's a state attitude. For some stuff, I think the state should do. Some other stuff, I think the private company should do. So it's not like a piece of paper that you will follow. Okay, that's gonna work. But what we are very sure it doesn't work is this very high tax over the things you buy, and that's why I believe. We are living in, like, Brazilians may think our cities are just ugly, but it's not. It's like Islam in a lot of points. Like let me see if I find the place I was today. It's called Antenna Hill. Antenna is like that stuff. Okay, here we go. I think we can go here. Okay. Yeah, unfortunately we can't see the hills here, but it's a lot of hills. And health is not just about a free hospital, it's about a good place to live, a beautiful neighborhood, a safe neighborhood. People here, some people say we were supposed to have guns like in the US, and yeah, I don't know. It's a hard thing to say because in some communities, especially in Rio de Janeiro, it's very unsafe, and the cops won't will go there. So maybe you are supposed to be able to defend yourself, but it's a very hard thing to talk about, especially if you live in a farm. The street here is not even so ugly as the ones I were today. I don't know. I think this neighborhood increased a lot since the last time it was we took a picture from it. But you see, it's already not a beautiful neighborhood. Everybody has walls, even in the small cities. It's kind of militarized place. But we say that, and maybe foreigners think, oh, it's gonna be very dangerous to go to Brazil. No, it's not like that as well. I'm just talking about some stuff here. See and suddenly there is someone very rich living in the neighborhood, and nowadays we have some people who is getting a lot of money selling stuff from in the web as well. But a lot of times it's like a scam too, and I have a web company, and I don't like to mix my company with these people. This one is not what I would like to show you guys. During the hospital, let me see. Posto de saúde. Posto de saúde is how we call the small hospitals in Brazil, in the neighbors. Oh, here we go. PSF. PSF is Programa de Saúde da Família. Family Health Program. Google Maps was supposed to get a zoom when we click there. It was hard to find this stuff, and it was even a house. It was not something built. It's not the same place I went. Sorry guys. In the next conversation I will try to show you guys a picture. Let's walk down the street a little bit more. In my very first day there was a woman there who was a car hit her. So see, it's a lot of people walking down on the street. We barely have sidewalks. So free health was not supposed to be just a free hospital. So that's what I would like to show you guys. And here we have a trash truck. So it's not, see, there is no way to that be hygienic stuff. You have 4 or 5 guys who are hanging up in the truck, and they go down the streets running, getting all the trashes with their hands, and sometimes they cut their hands because there are glasses in the trash can. So when you think about free health system, you should think about everything. So it doesn't matter if you have a free hospital if you aren't able to make more than $100 per month. So that's something you should be talking about in these conversations as well, because our system is not like free health and free college. Like I got a loan from the government, and I pay just it's not just for me, it's a lot of money, $200 per month, and then when I am graduated I will pay a lot more, but that wasn't easy to get as well. I studied during 6 years to get that, and I was supposed to be in the federal college, but nowadays they have this quota stuff. I don't know how to say that in English, quote system, and if you are black you have a quote. If you studied in the free college, the public college, during your high school, you get a quote. If you are indigenous, you get a quote. If you are Shimeio, you get a quote in some colleges. And there are some other quotes as well. And for sure, for Americans, I'm not white guy, and I'm not a black either. In Brazil, everybody's mixed. So usually when someone gets into the federal college through these codes, especially for the medicine college, for sure they have access to the web. So because even with codes already hard enough to get in, so they need to have at least access to the internet. And in the internet is where is the best video classes to study. Nowadays it's way better to study in your school or in your home through the internet than go to school and hire some teachers with a lot of people around you getting off your attention. For example, even in my college, I for sure it's way better to study here through YouTube and just the practical stuff. I go to the federal, to the public hospital to study, and I have anatomy classes as well. So why in the heck someone is supposed to have a coat just to be black, and for sure he's not making more money than me because of less money than me because of that, and for sure I'm not just white, and just because my color is not black, that's something very wrong for me. I've been working and studying all together. I have a company with 100 people, and some people who are getting these codes just because they studied high school in the public school. My parents worked hard a lot to pay the private college for me, and that was 15 years ago. I'm already 33, and for me things should be harder because I studied in a private school 15 years ago. That's not right, for sure. That's not. So yeah, that's what I think I would like to talk with you guys today. Oh, there is this documentary about from Michael Moore. I still didn't watch it, Sico. I still didn't watch it. I would like to ask you guys what is true and what is lie about it, and what do you guys think about the stuff I talked to you guys. Yeah, if you guys want to come to Brazil, please come. It's not so unsafe as everybody say, and maybe you guys had that idea because some stuff I talked about, but sorry for that, but it's not like there is a war on the streets. For sure you guys will be very well received here. If there is something Brazilians know how to do, is how to receive people here, especially because we don't have many foreigners coming. It's different from the US because you guys have the whole planet going there, so that's probably sometimes not so cool, right? So let me know, and I will keep recording that. I think I will call this TV show Decoder Doc, right? Because I am a coder and a doctor, and I'm still I'm actually not any one of that. I don't consider me a coder because I'm not good enough, although I have the platform, but that's because I am very good in project. I did the basic stuff, and I have talented people who trust me, and I did the basic to build that up, and probably it was not so basic, and I have been a little bit humble as well. But it's my first period in the medicine college, so I hope to see you guys more, and please comment what you think about all this stuff. Thank you, bye bye.